Hello, everyone, and welcome to this webinar. This is one of our Tuesday evening webinars that we usually have. And this one's quite a challenge, really, because we've got one person here from Bath and the other person is from Seoul in Korea, where he's doing some work with the Olympics, and he's here in the middle of the night talking to us. So if he falls asleep, be patient. But he looks very lively. He looks very lively at the moment. Anyhow, what we do in these evening webinars is we talk about some of the big issues that face us. And what we're doing in this one is talking about the digital world, and particularly young people and health, and how those two forces, youth and the digital world, combine together. Increasingly, young people are using digital apps and digital means to find out about their health and well-being. They're checking their symptoms, they're finding out what they can eat and what they can't eat, what exercise they can do, where they can go to, who they can go to, rather than seeing the GP. And there needs to be a lot of support for that. And the two people we've got on tonight have got a huge project funded by the Wellcome Trust called the Digital Health Generation, which is beginning to look at that. And they're going to do some webinars with us, and we've got a House of Commons meeting coming up as well that actually looks at that. So you can see that we've got Andy Miah here, and he's the one from Korea. And then we've got Emma, and she's all the way from Bath. and they're going to do a presentation for us. Now, when they talk, you please don't wait to put in your questions or comments. Put them in straight away so that when they finish their presentation, we can put them to the two people straight away. Now, this webinar will be recorded, so it will be sent out to all of you. It will be on our social networks, and you can disseminate it and distribute it widely, as we will as well. Anyhow, thank you, Emma and Andy, for doing this. And I'm going to go over to you now to start your presentation. And now, Emma, we start with you.
Okay, thank you, Francis, and thank you everyone this evening for joining us. I'm certainly looking forward to some discussion. So as Francis has mentioned, this is a project that's funded by the Wellcome Trust, which we've titled the Digital Health Generation. So thank you to the Wellcome Trust for the funding for the project, and to all of the participants that are currently involved in our data collection, to the teachers, students, and families who are taking part in the research. So I'll just bring up the presentation on screen. Okay, so just by way of introduction, so obviously myself and Andy are here tonight, but there's a couple of people on our project team that aren't with us that I'll just mention. So Professor Deborah Lipton, who's based at the University of Canberra in Australia, writing extensively around issues of digital health, self-tracking, quantification, and has a really interesting blog. So if you get a chance, go and have a look at her blog, and regularly writes about various topics and issues related to digital health. And Dr. Sarah Lewis, who is part of our team here at the University of Bath. So a collaboration really between those three universities, and we're really looking at how young people are engaging with a whole variety of digital health technologies. So my background, I work in the fields of sociology and education. So for a long time now, I've been very interested in how people learn about health through various means, from searching online, media campaigns, through to sort of formal health policies and practices in schools, and how that shapes people's health behaviours, but also their well-being and their identity. So very interested in what people are learning in terms of their sense of self, and as living life as a kind of healthy citizen, and particularly interested in young people. So worked with Andy previously on issues of back in sort of 2008, when we wrote a book on the medicalization of cyberspace, really interested in how technology was shaping how we came to learn about health and different health practices. So I'll hand over to Andy now to introduce himself and say a little bit more about digital health more generally?
This next slide is a bit of a glimpse into, I guess, the kind of breadth of the subject in lots of different ways. So what you're seeing here is a mobile application which is taking images from Instagram and transforming them into nutritional information. So this works with what is now quite simple technology, where with any given image, and of course with a product like a bottle of beer or a packet of crisps, the image of that product is always the same. So you can create an image identifier and then transform it into something else. So in this case, what we're seeing is the calorific content of the products. So for me, this works on a number of levels to explain the kind of complexity of this world of digital health. On the one hand, it's about trying to understand how people use data and make sense of it, but also how the platforms themselves may become, I guess, something completely different from what we had imagined. Who would have thought that Instagram, this place where people share photographs of their lives, could suddenly become a platform that is pertinent to understanding people's health? And I think that's one of the real challenges with the subject, is that it's become such an expansive area already very quickly. And even over the last sort of few years since Emma and I had started working in this field, we've seen the implications of that for how people make sense of their health, to the point where I think healthcare services, the NHS in particular, perhaps in the UK, has really struggled to figure out how to make sense of both what people are doing in terms of digital health, but also what its role can be. And I remember a few years ago, they tried to kind of make a number of recommendations as to what people could use as platforms for engaging with health information. But of course, it's all well and good for a healthcare service to propose what people use, but in fact, people will use what they use to discover information. So people tend to use Instagram or Facebook to connect with other people or to find out about health. That's what they use. And one aspect of our project will be to use WhatsApp as a method of data collection. And we're quite interested to make sure that when we try to understand what young people are going through, that we locate the research within the environments where people are comfortable. This is the benefit of our digital world, is that we can do research without having to pull people out of their sort of habitus, as we talk about it in sort of academic terms, the place where they tend to live, and put them into sort of artificial laboratory settings and ask questions. Instead, we can ask people to utilize their mobile phones as the platform data collection and remain in the place where they are comfortable. So this image conveys the sort of complexity of this area. And just moving on to this, this is a photograph from the Olympic Games. As Francis mentioned, I'm here in Korea at the Olympic Games doing research broadly on technological change. And one of the things that's already been apparent is just how much mobile is driving activity across all sorts of levels. And this image, which is actually taken from the Samsung Pavilion. Samsung is one of the big sponsors here at the Olympic Games. And this actually is it's a photograph of their vision for the future of gymnasia. And what you're seeing is their power walls. So these are essentially running spaces, and you interact with the screen in the course of your exercise. And all of it is also predicated on the fact that you are collecting data about your activity through your own mobile device. So, and this is already a sort of shift that's taken place within gyms. When you go to a gym, you can log in with your social accounts and make sure you track and monitor your activity. And that act of tracking activity is also something that we're very interested in, trying to understand both what people are comfortable doing, but also the culture of sharing data about their physical activity, and the implications of that for how they feel about themselves. So, if you think about something like Strava or Nike Running Plus, where people are kind of encouraged to share what they've done in terms of physical activity, this can create certain degrees of anxiety for people if they're not being physically active. So we're quite keen to understand how this mobile app environment either encourages people towards certain kinds of healthy behavior, but on the other hand, how it makes them feel anxious about their behavior and perhaps feel coerced into being physically active in different ways. And so what we're seeing within these environments is a kind of convergence of the digital and the biological worlds. And in fact, one of the things that happens here at the Games, every athlete, when they arrive, they actually receive a a mobile phone from Samsung that they then keep. And this is built with lots of different applications that allows them to keep in touch with family and understand the information of the games. But it's just continually encouraging people to think of themselves as intimately connected to their mobile devices. And that's a big change in terms of how people grow up. The fact that they would go to a digital device, perhaps as a first source of information, is a big change, both in terms of how we connect to kind of legitimate authorities who may have health information, but also the possibility that we either become more reliant on a social network for that sort of information, or become locked into platforms that may lead to unhealthy habits. So yeah, with that, I'll hand over to Emma, and we'll talk about some of the things we've discovered already, some of the key issues in this area.
Yeah, so the background to this, of course, is that there are, an extensive global mobile and wearable health industry. And in our project, we're particularly interested in what we would refer to as kind of healthy lifestyle technologies, which differ somewhat from what we might call medical devices, which in some ways lead to some sort of diagnosis or might track something like glucose levels or heart rate, and have implications for patients. We're partly interested in these healthy lifestyles because of their exponential growth. So they are, selling by billions, and they're incredibly difficult to navigate. If we look at, for example, the range of healthy lifestyle or health-related apps that are available in the App Store, 165,000 and growing. So this really raises questions for us about how people navigate those environments and how they make decisions about what are seen as healthy or legitimate or reliable sources of information. And then secondly, what they might do with that information. So once we start quantifying ourselves, we're placing our bodies under processes of monitoring, quantification, and surveillance. So there's a range of, I guess, ethical issues that we're looking to explore within this. There's also the issue of the way health knowledge is not just being produced through this digital media, but of course, people now have the capacity to produce their own health knowledge, whether that's experiential or through the release of quantified data about themselves. And again, there's questions about where does that data go? How is it being used to make decisions about future healthcare, issues around insurance, for example. So all of this kind of future trend raises a series of questions for us, not just about health knowledge or the trajectory of healthcare, but what kinds of impact is that having on the kind of everyday engagement that people have with their bodies, with their identities, and with their health behaviors. So of course, vast range of technologies, and looking to sort of develop even further in terms of the size of those technologies. They're becoming increasingly part of ourselves, the kind of wearable and even ingestible technologies that are becoming increasingly popular. So a massive shift in the way that digital health is taking place, the way that knowledge is being created, and indeed accessed around the world. So our story so far in terms of our project, so really the question driving this is to look at the impact of this shift in terms of the prioritizing of the digital and the turn towards digital as a solution to healthcare crises. What impact is that having on young people's learning, on their identities, and indeed their health practices? What do they actually do as a result of engaging with these technologies? So as Andy's alluded to, we're using a range of technologies themselves to actually undertake this research. The first has been an online survey, but we're actually using local schools in terms of the participants. So asking 11 to 18-year-olds, getting a sense of the key milestones. What do they use? At what age do they start using this technology? What are their concerns? What type of media do they find most helpful? So just getting a sense of the terrain out there in terms of what young people are actually doing. And interestingly, sort of one of our key statistics so far is that the ownership, and perhaps doesn't come as a surprise to many people, but increasingly younger in terms of ownership of their first mobile or tablet device. So average really around 8 to 11 years of age. Some were younger, so sort of 6, 7-year-old, but most young people were saying they had a device of some sort by the age of about 11. We're currently in the second phase and entering into the sort of third phase as well of our research project, where we're doing more in-depth work to understand what it is young people are actually learning about health, issues around sort of numerous ethical issues around reliability. How do they know what's safe? How do they navigate choices around what to use, and what do they actually do with the information that they collect, whether that's in terms of quantified data or indeed when they go online and search for different forms of information. And in the final phase of the project, we're experimenting with I guess what you might call a live methodology, using WhatsApp to talk to young people as they're actually using those technologies, partly because we want to get a better sense of the kind of the design of the technology itself, how that might affect how people use it, whether it's comfortable to wear. But primarily that phase is really driven by an interest in inequalities and the contexts in which digital engagement takes place. There is a tendency to see these technologies as somehow removed from the rest of our social and cultural context. So, for example, how does family life interact with digital engagement? How does it shape what we use or influence what we use? How do young people share what they're seeing on their devices with the people around them? Where are they when they decide to go online and search for information? So we're trying to get a better sense of that relationship between, for want of a better expression, that relationship between the online and the offline world, if there is such a thing now. And one of the key questions here really is why young people? Why does this particular group interest us? And really, we might think about young people as the first generation to enter into a digital healthcare system, where the digital is being prioritized as a solution to a number of health problems or health crises. Alongside this, they're sort of described as various terms such as the app generation or digital natives. And we're fairly skeptical of this idea that young people are this homogenous group who can navigate the digital terrain with ease. And certainly some of our interviews are starting to illuminate some of these issues in terms of the challenges of making sense of data, of digital literacy and so on. But this idea that young people are just very, digitally savvy, yes, they are using a lot of these devices, but there are a number of questions about how prepared they are for this landscape. There's a number of ethical questions, and certainly we're seeing an increase level of surveillance, both of each other. So, social media is a very popular platform for young people, and a willingness to share images related to fitness or dieting, or to share very private information about themselves, whether it's what they're eating or how far they're running or what they weigh. But that willingness to share images and data raises a series of questions. They are subject of surveillance in other ways as well. So we might begin to think about what choices young people have in terms of being the data being collected on them or about them. So an interesting example on the screen here is this trend towards what we might see as toys. So there's one on the screen there, which is a watch, but it's actually a tracking device. So it's supposed to capture how much a young person moves. So as young as sort of the age of 4 to 6, parents now using these technologies to get a sense of how much their child is moving. So again, some ethical questions there about how we monitor and survey young people. Some interesting work by Ben Williamson around the increasing use of technology to collect data on young people generally, increasingly the move towards smart schools, collection, calculation, and circulation of information about children. And we're seeing this happen increasingly in relation to sort of health technologies within schools, in terms of physical education, the tracking of health-related behaviours of young people. And again, our survey data is indicating that young people are certainly using their mobile as a key source of information to learn about health, but they're also actively tracking themselves. So 52% of our survey participants indicated that they were using an app to track their diet, fitness, and or health in some way. And again, perhaps no surprises here, but Instagram and Snapchat were their favorite social media platforms to learn about health. So some critical issues, and perhaps we might talk about some of these following the end of the presentation here, but one of our sort of key questions here is how do we prepare young people for the digital world in relation to health? What kind of resources do they need to navigate and make choices around digital platforms, but also how they interpret their data? So when we see here that YouTube was reported as the top site to help young people learn about health or understand health better, there really is some questions here about what types of platforms they see as legitimate, as helpful, but also what sorts of things they're learning about in those environments. And interestingly, and maybe this is a challenge, but I think also an opportunity, that young people are reporting a willingness to share their data. Parents came out on top, 64%, but also health professionals and friends. So again, we might ask, how do families, how do health professionals, how are they trained to actually respond and help young people make sense of that data? But increasingly, they're demonstrating that they're worried about finding the correct information online. So again, signs that they might need help with kind of navigating these terrains. Another issue really for us is this issue of digital health inequalities. Again, the assumption that everyone in these digital native terms is equipped to navigate, access, and understand the digital context in which they're learning about health. And certainly, you know, access, affordability aren't the only issues, but certainly come out as a striking one in terms of being able to afford the technologies that peers might be using or other families, but more complex issues as well in terms of relations of power, about who has access, who has. So a number of our participants said that they shared their devices with other people. So again, some questions there around access, literacy, and inequalities around digital health. I'll hand over to Andy.
So just to follow up on that, I think, yeah, just also following some of the questions about it as well, the complexity of having too much data, I think, is a really big concern for us. At the same time as understanding what it means for someone to have a kind of data trail across their lives, and how that may shape their understanding about themselves or their misunderstanding about themselves, perhaps. But also how it does lead to certain behaviors being formed. Now, of course, from a sort of governance perspective, there's a desire for data tracking to be a way to encourage healthy behaviors. But as Emma mentioned briefly earlier, there are concerns about how this may become not just a coercive environment, but how in fact it may be an environment in which there is sort of serious questions about social justice. So, for example, if you can only get health insurance if you begin to share your data about your physical activity, because on the basis that health insurance premiums may be reasonably affected by understanding what kinds of physical activity people are doing, then we suddenly find ourselves in a world where that's become a requirement for people to do in order to get healthcare. And that's already become a kind of live topic in certain parts of the world, where there are health insurance companies that will give you incentives to be physically active to get lower premiums within your healthcare. And so part of this project, and I'm just conscious of time at the moment, so we'll wrap it in a moment so we have a discussion. But this is such an expansive world, and the project sort of sits within. One of the reasons we called it the digital health generation is to recognize that whilst we have this project, it's really part of a bigger range of work that's taking place in this field, and we're quite keen to connect with people that are also doing research in this environment. And that's not least because this area is becoming increasingly complicated, increasingly expansive in its breadth. So recently the NHS spoke about artificial intelligence being the kind of solution to healthcare, and the NHS have begun experimenting with an artificially intelligent mobile application which you chat with in order to diagnose your problem. In the last few months, in the US, the FDA has approved a digital drug. So this is medication with sensors built into it that when you swallow it, it talks to your mobile phone and tells you what's happening, or tells other people what's happening with that medication. So we're very conscious that this is an area that is becoming incredibly complicated, but incredibly pertinent, I think, for people's lives. So figuring out some of these privacy issues and security issues is crucial. Not least because the question of simply around data and who owns our data and what we can do with our data are really critical issues of our time, at a time where certainly in the UK still we are very limited in our capacity to actually access our medical data. So there are questions about agency and empowerment that are pertinent here. We're keen to see whether in fact the younger generation are in a position where they feel more empowered, or in fact whether they feel they're kind of coerced and cajoled into this sort of world. So we have just a few things to wrap up with before we have the discussion. So I've mentioned already in the chat window that we are creating a WhatsApp conversation. We have thought about the best way to keep people in touch with the project, but also to expand our network around it too. So if you're comfortable with WhatsApp, then by all means send me a message and we'll add you to the group. We also have an email group. I still use email groups a lot for information, so by all means feel welcome to join both. And we'll keep you in touch with the project. We're very keen for these webinars to be a way of connecting with what you do and hopefully expanding the breadth of the project as well. We're looking towards also further funding in a subsequent year for this work. So again, we're looking for collaborators and potential areas of development. So we're really keen to hear from you about your work as well. We'll be running a webinar every month. So we're looking at doing one in March, which will cover mobile health applications. So we'll look more closely at the apps that are out there and what they do and how they work. But also more recently, the NHS has again released a new sort of library of applications that it recommends. So have some discussion about that as well. And as Francis mentioned earlier on, we're going to have a meeting in House's Parliament on May the 16th. So we'd love people to come along to that as well.
Okay, thank you, both of you. I mean, that was a very good initial description of what you're doing, an overview in a short time, and you got through a lot of stuff. And obviously, you've generated a lot of interest because there are more questions than I can probably handle. I need to help myself. But it's quite interesting. Bex is saying, for example, that he's already beginning to share here his problems, like he's talking about he is beyond chocolate and he's decided that he's got to watch his health, so he's looking at apps that measures his steps and so on. Now, you know, is it your experience that people go on and use these apps, you know, almost tabula rasa from the start, or they do it after they have a problem?
I mean, I think it's quite varied in terms of the motivations and reasons why people end up downloading particular apps or platforms. What we found with young people that we're starting to get a better sense of, I think, is precisely that, some kind of issue or concern, and then looking to the digital for a solution towards that. And weight loss seems to be one that, particularly for younger people, very much on their mind in terms of body image. And I think the marketing within some of those campaigns and apps is really interesting. It's highly gendered, very moralized, and increasingly seen as a kind of solution to motivate you, but also give you the correct information. And there's so many of them, and they seem to differ in terms of their strategies. But yeah, I mean, I think it's pretty varied, but we are seeing increasingly young people having concerns and looking towards the digital to help them make sense of it, and also to engage in dietary advice or track their physical activity. Yeah.
And do you find young people share more than older people? And I mean, Hannah raises an interesting point that sharing actually makes young people more confident to go to their GP. So it's not against the GP, actually it's complementary. They're more likely to go and they feel more confident about it.
I would say there is a sense of that. But there's also a sense of apathy from some young people that this is just very normalized for them. They're used to kind of tracking and sharing and engaging with things online, that it doesn't seem out of the ordinary, I suppose, to be also collecting and sharing information about health. We haven't, as Andy says, we haven't got that far into the interviews to be able to say whether that's something that is giving young people a better sense of being empowered or challenging more authoritative knowledge around health. I think partly that is because they're having to make sense of very sometimes competing information or contradictory information. So that's something that's come through.
I mean, one of the things that we're not looking at sort of primary school age children, although having a son that's 7 years old, I'm very aware of how the teachers within his school are very almost defensive about the internet. They have to, I believe they're told to give an internet safety lesson at, I think it was year 1 that my son went through this, and got home a letter talking about what to do and what not to do online. And I was quite shocked by it, really, because I felt this is a world that, in fact, I'd rather he waited a couple of years before he discovers and has to worry about. But so I think from a very early age, both teachers are anxious about how best to approach this subject, not terribly encouraged to do much with it except for warning children about it. And we're quite keen to explore how we might engage with schools more positively to try to allow children a chance to engage with some of these discussions. So perhaps having an after-school digital club where people can either bring their mobile devices, because of course mobile devices are banned in schools often. So it's a funny world where you have this proliferation of digital devices that have become completely commonplace and normal, and yet schools, even the place where people should expect to learn about these things, are actually pushing them away and struggle to do anything with them during the curriculum, because they are not sort of public assets, they're privately owned, and that creates lots of challenges for the schools. So there's a real disjuncture here, I think.
Yeah, there's another tension there in terms of sort of funding cutbacks as well. So, examples of schools using apps in place of other resources. Example might be, school counsellor. So instead, a mental health app is offered to children. So there's also the question of how those technologies are being drawn into schools in ways that perhaps haven't been used before, and there may be opportunities there for young people to explore some of those issues around sort of digital literacy or critical literacy of what they're using.
But one simple example perhaps of just how things are changing, this NHS application that I've mentioned in the chat window, Babylon Healthcare produced, which is essentially an application you download and you start having a conversation with a bot. So it's an automated conversation, but it appears as if you're having it with a person. And it sounds for many people very sort of dystopian, this idea that we're cutting out the doctor and just going to a machine. But I think what it shows partly is that out of the sort of context where people are very critical of the NHS 111 service, where people telephone, I guess, call centres essentially, and get similar sorts of advice, we've moved into a world where perhaps people are more comfortable chatting through text rather than being on a phone speaking to someone, and that might be a behavioural change that allows that encourages the NHS to approach it in a slightly different way. So even that might be something that is a very big shift in what people are able or comfortable to do. The telephone is less of a telephone than it was in the past, perhaps.
I mean, you say that, people do this and they share and they look up information. You were saying your child, Andy, who is 7, is using it. Hannah mentions her daughter, who is also 7 or 8, using these devices. And that gives a big responsibility for schools. I mean, in a sense, there's a cultural gap because teachers very often don't understand what young people are doing. And do they need help to understand more because of that cultural sort of divide?
It's just over 10 years now since the first iPhone. So the children that are now sort of entering secondary school have grown up digital, and the teachers probably haven't, and I think that's a massive gap. But I also think that the digital literacy is a kind of lifelong project, and ultimately, if you kind of lose track of how to work things for a year, you basically lost everything. You can't figure anything out at all. It's like the remote control for the television, but on steroids. And it's a whole big challenge to allow people to feel comfortable in digital space when things are so fast moving. Even and the fact that we have sort of obsolescence designed into these mobile phones means that we're kind of forced into relearning everything every 6 months almost, and so that's a huge chunk of work that I think is required to allow people to be at a point where they actually feel comfortable and capable of getting the most out of their device, which most people, I guess, don't.
I mean, Anna is worried that, if people become more and more reliant on digital means to find out about their health, serious illnesses might be missed. There are huge gaps that can't be filled. And that's a real problem. I mean, if you found that's a problem, how do you deal with that?
I think there's a lot of work in trying to connect patient groups together, and that's where I think that's an interesting aspect of this, because of course we tend to think of patient support groups as adult things, and so we wonder, in cases where perhaps people do have an illness and they are under 18 years old, what do they do in terms of finding that support group to help them? And that's part of the project's interesting to see how not just the digital device, but the network around it provides some form of supportive care. Now, but it's sort of interesting that the way in which we're approaching these subjects is that, and this came up in the chat a bit earlier, is that if there's enough data, then we should end up with a better solution. It's a bit like back in 1997 when IBM's Deep Blue machine, an AI machine, effectively played Garry Kasparov at chess and ended up beating him for the first time in history. And I think if you sort of model that onto healthcare, you could approach it by thinking about, well, you might go to one doctor, but actually if you could benefit from the insight of 1,000 doctors in diagnosing your problem, then that might be a better solution to be in. But you might sacrifice that personal touch in getting your care. But I guess people, if they find the artificially intelligent app better or more effective at treating them than the human, then wow, that might be a massive shift. It's a long way to go there, I think, but certainly the anxiety, I think, partly when the NHS is that, in fact, keeping up with this and being able to make use of the data is the kind of key priority at the moment, because actually they don't tend to do that very well.
I mean, Terry talks about the fact that if you have a lot of data coming across, big data, okay, it might benefit the people who are collecting it, but for the individual, there's almost a sense of diminishing returns. There could be a fatigue factor, and that could heavily affect how they respond to the data that they share.
Yeah, and I think there's some questions there about what that data is being used for, and how populations or certain populations come to be defined as at risk, or those, if you think about some of the ongoing health inequalities, I think that there's also potential for big data to identify trends or gaps or inequalities around healthcare that could be quite useful. But essentially, I think there's some really challenging questions about who has ownership of that data, what it's being used for. And absolutely, I mean, sort of typically in terms of app use or device use, there's been reports of, fatigue and boredom and 6 weeks of engagement with the technology, and you want to move on to the next one. But I think going back to Andy's point, that there's also an issue of once we start to share data, where does it get locked into, and what kinds of ownership do we have over our own data? And I think that's a huge challenge for young people. We've spoken to some, and they see issues of privacy and data security as simply being about having a lock on your phone. So I think in terms of what schools can do, there's a great deal we can do in terms of getting young people to think about what happens to my data, and third-party issues and data rights and privacy. But so I think there's both challenges and opportunities there in terms of where does the data go and who is using it.
But I think there was another point they were raising, and I think you raised it, Emma, in your presentation, that more data of different kinds can increase for an individual an anxiety level.
Yeah, absolutely. And there are some very avid users of data in the quantified self movement who visualize and track all aspects of their lives, every day. But I think it's very difficult for many of us to make sense of what that data means. Some of it can be very clear and quite damaging. So reports of young people being labelled as overweight or obese can be hugely damaging for their self-esteem, but also what they then do in terms of their health practices. So they might then engage in more forms of self-tracking or go on crash diets. But equally, I think that's a really challenging issue for the future, because there are so many apps, and of course some of them are already built into our devices and collecting data before we even choose to do so. But we're increasingly quantifying and monitoring more of our behaviors, from sleep through to what we eat, activity levels. Every part of our life now, I think, can be quantified in some way.
I think as well, I mean, Bex is saying, for example, that the anxiety may come from the fact that there's not always good quality stuff on the internet, and people pick up wrong things, and there's fake news about health. I mean, have you looked at that, and how do you tackle that?
So we haven't looked at fake news specifically, but we're very sort of aware of this having become a big issue over the last sort of 18 months or so now. And certainly one of the key, I was in a debate recently where it was discussed how health related information, particularly around sort of lifestyle applications or information that we're interested in, like fitness and nutrition and those sorts of things, are a significant source of fake news. And even if you kind of just think about the sort of pseudoscientific information that's been out there well before the discussion of sort of fake news about how best to diet. I mean, dieting as a concept where there's incredibly contested information about how well to do that or how to do that well. Well before we even get to the digital world, there's massive disagreements about what that should entail. So it's a very challenging environment to be in, I think, if you're a young person to find yourself sort of bombarded with things. One thing to note, though, however, and again, this sort of speaks to just how much has changed, is that young people are reducing the amount of time they're going to websites. So even the idea of a website is becoming kind of out of date. Everything now operates within mobile applications, and there are concerns about that too. So the fact that you are kind of locked into platforms that are owned by people where the data policies are unclear in terms of how it's shared. So that makes it also challenging to do sort of the work that we do, because the internet has become something very different. And we're sort of anxious, I suppose, also that that we don't understand a great deal about the journey someone goes through with a particular application. So if you think about your own sort of tracking behavior in mobile applications, or things that may track your activity or physical location, those sorts of things, people's own individual journeys vary considerably, but also where you start with a mobile application or a wearable technology may be very different from where you end up with it. I remember I've had Fitbits in the past that are now just sort of buried in a drawer somewhere, and I don't use them at all. So, and so I think understanding just what children or young people are going through in terms of those devices or those platforms is a big gap in our knowledge at the moment.
I think sorry, Francis, the other thing to add there is in terms of some of the anxieties are, young people are avid followers of people online now. So whether that's YouTube or, fitness bloggers or those talking about the latest trends. So there's a lot of interest in trends. So things like clean eating and people who are sponsored in terms of fitness accounts on Instagram. And that's a very difficult terrain, I think, both in terms of the anxieties it might produce around the correct kind of image, demonstrating that you're the kind of right, healthy citizen and doing all the things that you should do. But it's incredibly tied to the people that they're also following and what they advocate. So I think it's both about the data, but also the popularity of the way in which social media platforms might operate now.
Yeah, I think Terry and Bext also, I mean, Terry particularly said, he did some research on the websites, NHS websites and others, and they were in a complete mess. But in a way, Terry is sort of almost my generation, and we look at websites, but you're saying young people wouldn't look at those now. Is that right? They go to apps. And not only would they not go to apps, they wouldn't go to text, they would go to YouTube and they would look at video a lot more. So do an investigation on how young people use digital means to find out about their health. Very different to the way you would if you were investigating me and Terry.
Yeah, certainly. And if you think about just your journey into information, whereas in the past, certainly myself growing up, we had, I think, maybe 4 or 5 television channels. There might be 1 or 2 newspapers in the house at most. And the situation today is that there is no sort of channel that has authority for young people. In fact, when you buy your mobile phone or when you get given your mobile phone, it comes built in with a news aggregator from sources that you've never heard of, but that becomes your default platform for getting information. And younger people don't tend to watch television. They YouTube hop online. And so there's a whole shift in how people receive information about everything. And health is a big part of that. So understanding those processes, but also those sources of authority for young people is a big part of what we're interested in too. Where do they locate the NHS within their own sense of what is authoritative about health? Who are their kind of key informants for understanding their health? There's I think a strong expectation perhaps that in fact the social network becomes the authority, and this of course is the sort of vision of the internet that sort of it began with, that in fact we don't rely on experts anymore, we rely on the network to kind of create expertise. And yeah, as sort of mentioned in the chat already, there are some challenges around that in terms of whether people actually get the right kind of information at the right time. But what's interesting is that in the BMJ, British Medical Journal, just a few weeks ago, that company Babylon, which is essentially about trying to promote the idea of video consultations with GPs as a principal way of providing healthcare rather than having to go to a surgery, is really growing. And it makes sense that, in fact, for certain parts of the population, being able to access a video consultation is much more appealing than having to go all the way to the hospital or to the surgery. So there are there's clearly value in trying to utilize these sorts of things, but it's still hard to see when there are losses as well.
Hannah says that she uses, apps to measure her diet, her calorie intake, how far she walks, and she gets competitive with her friends. Now, I mean, we can laugh at it, but it's not a danger with young people. I mean, they compete anyhow about how they look and how they get on, and there's a lot of bullying online and so on. Is that competition have a negative impact as well?
Yes, very much so. I'm sort of thinking back to some work that I did in schools a few years ago, which looked at some of the changes to school-based policies and practices associated with tackling obesity. And of course, one of the primary changes there was around measuring and weighing young people, and did some research with girls who had experienced eating disorders. And all of them referred back to those key moments of being measured, and that it led to kind of hyper surveillance and competition of each other. And we then went on to do some research with a broader population of school children, and found similar things, that those forms of screening and monitoring become ways of comparing and contrasting each other, but also as a way of standing out, that they might be the thinnest or the healthiest. And I think one of the risks with any kind of form of quantification around health is that it can often be limitless. You can always run a bit faster or lose a bit more weight, and it's one of the things that young people tell me time and again that they struggle with, is knowing when they're healthy. When have they reached that point at which, according to the stats, according to the health information, they're in a healthy state? And of course that changes daily, doesn't it, in terms of what we should be eating, how much we should be eating, what we should weigh. So when we sort of reduce complex health issues to numbers, there's always that risk that we get competitive, and it's heavily moralized. How often do we kind of like to share with people we've been for that run, or we feel bad about having eaten something. So, and we see this a lot on social media, but also the kind of hashtags or social media campaigns that are associated with some of those products. So communities actually sharing data or status updates as to what they've eaten or what they've been doing in terms of exercise as a way of motivating each other. So it can be productive, of course, in terms of motivation, but there are a lot of risks and documented research around this in terms of the kind of risks and often quite disordered health practices that might lead to in terms of over-exercising, increased surveillance, or extreme dieting.
I mean, you mentioned in your presentation, well, you both did, the ethical questions, and a lot of questions have come up on the side about big data and the companies owning it. You can find with big data, you can find out almost anything about anyone nowadays if you combine all the platforms together, and you can find out more what people want than a referendum. But it's companies that have that. And Bex mentioned the book The Circle, which actually is a fantastic novel to read, which is about how a company wants to take over all our behavior because of big data. Now, I mean, how much is that a problem that we're handing over our health to companies? And those companies, you mentioned insurance problem, that's for sure. But there are all sorts of other reasons why they want to use that big data. And how do we create a regulatory framework that would make young people confident that what they're using is sort of neutral and they're not going to be inundated or controlled in any way?
I mean, I think that the really worrisome aspect of this conversation is that as we become, or as healthcare becomes more reliant on data, it becomes increasingly locked into proprietary systems. And so it becomes a challenge to get out of them once you sort of begin down that road. And that's why in terms of, and it's appealing to go down that road because, of course, the NHS, its own sort of systems will be far inferior than probably a company like Google and what it can provide for them. But once you begin that sort of process, I think the long-term implications of that in terms of locking down healthcare into a particular media company is really quite devastating, I would say, which is why I mentioned earlier in the chat that I read that Google's looking at creating its first hospital. And you can see how the data that it creates through its mobile applications, through all sorts of search inquiries that it receives, can become really important information for a healthcare service. I remember reading about how data through Google searching might be used to be able to track flu epidemics emerging. And you can see how the NHS may seek to utilize that data for all sorts of reasons, maybe preventative or just responsive. But without some kind of framework to both encourage people to see that, in fact, their data is possible to access themselves, but also understand where it's going to go is a massive challenge. And we're nowhere near solving it yet. I don't know whether that's on the minds of young people. I guess I always love the idea of sort of young people sort of rising up against social media and realizing, in fact, they're not going to share all their stuff with these companies anymore. But there does seem to be just a kind of acceptance that this is the way of life. This is how one lives as a young person, and that's probably something to just kind of push against, I would say.
But how do you, I mean, I think Andy's right, the excitement of being young and using all these things, you don't think of those ethical questions, but someone has to, or they're going to get sucked into a system that they may regret later.
Yeah, I think you're entirely right. I mean, I'm not sure this is on their horizon right now, but I guess one of the other questions is, if you think about the individual in all of that, is the sort of government discussions not that long ago about whether digital data, as Andy pointed out earlier, becomes a way of demonstrating that you are the healthy, dutiful citizen and should have, priority access to healthcare. So given the pressures that the NHS are under, discussions around, particular crises and funding issues, there may be a point in the future where demonstrating your healthy track record and engaging in all the behaviours we're expected to undertake may mean that you you sort of jump the queue in terms of accessing healthcare. So these are discussions that, you know, have taken place. We're not there yet, but I think, you know, we will have increasingly longer and longer digital footprints through which to demonstrate that we're living healthy lifestyles. And if we become locked into those systems early on, then it does raise questions about what the future might look like for young people.
In a way, I mean, we've talked about digital health, we've talked about how important education is, but several people asked question about the role of the NHS in this. I mean, is the role of, should the NHS be central to digital health and the information that goes out, or are we handing it over to the privatized big data companies? What's your contact with the NHS? I mean, have they got their act together? Is there enough joined up thinking and joined up working? Do they understand what the issues are, or do we have an issue there? Do we have a problem there?
I mean, I think that the NHS is incredibly technologically challenged. I don't think that's a secret. Really, it's certainly, I mean, the work that I've done in close proximity with them just makes me aware of how working with big data companies is incredibly appealing, because they've figured out how to provide platforms that are easy to use, that are kind of capable of generating useful data for being able to invest into platforms. But the thing that perhaps is most important is that the NHS has for many years relied on this sort of model where it sort of commissions a digital solution and then is locked into it for so long that it becomes redundant almost at the point at which it's begun to be used by the NHS. And that's where alternative commercial platforms are much more agile and capable of just upgrading very rapidly. And so I think that's one of the biggest problems it faces, which is why I think there's a lot of anxiety about it, because ultimately, if you can't provide the sort of care that people are comfortable with, then it makes it harder, I think, progressively to remain relevant. So I think there is a major concern here, but that informal healthcare service that happens within social media is perhaps what we're kind of getting at, is that in fact young people may be growing up in a very different world than perhaps we did, and engaging with health information quite differently.
And I mean, do you find in your work, Emma, that you know, the NHS is challenged? It's a real problem you have.
I think what's interesting for me so far in this project is some of the young people that we've spoken to are still looking towards the NHS for guidance. So that's interesting, because I think on the one hand, there's a sense of a whole range of other devices and platforms which exposes them to potentially risky but also alternative health knowledge, and that they might become producers of health knowledge themselves. But there is still a sense of, you know, the NHS being the kite mark or the rubber stamp of what is safe and what is legitimate. I think the other challenge is that, you know, I mean, we've just done a review of some of the policy documents around digital health, and the notion of inequality within the digital world is very, very limited. There is an assumption that young people are digital natives. There is an assumption that the digital is empowering and that we all have access to it, and that, you know, we can navigate it. So, and I think inequalities need to be understood in a much more complex and nuanced way than simply an issue of whether you can afford to have internet access. So, you know, people bring very different experiences to the digital world, and I really think that that's something that, as the digital footprint, the gap around that increases, young people are going to experience health very differently. And when, you know, we think back to some of the organizations and individuals that we mentioned earlier that might push those technologies onto young people, whether it's GPs, coaches, parents, you know, other health professionals, there are questions around how equipped young people are, and you know, the assumptions around healthcare systems that the digital is always the solution.
Okay, well, we've sort of come to the end of the webinar, come to the end of the hour now, but we're going to do a couple more webinars. We've got the House of Commons meetings. Andy, would you like to say one final word how people on here might help and send in any information that might help you and might help us develop the other webinars?
Yeah, so as I mentioned a couple of times in the chat, we've got a WhatsApp group for conversation. I'm very conscious that seeing all your names, I don't know what everyone does or how they have become interested in the subject. So we'd love to hear from you by whatever means you feel most comfortable. So there's the WhatsApp group that we're creating. There's also a Gistmail email group. You can also just email us as well and tell us about your work and what leads you to be interested in this. And again, we're quite keen to expand this project. So whilst the website for our project is principally just us writing about the work and blogging a few things, we're very keen to invite people to contribute as well. So if we can connect with like-minded people that want to do research in this area or want to help with research, or you maybe have some contacts that can help us explore new areas of data collection even, we'd love to hear from you. And certainly, yes, as Francis mentioned, we'll have another one of these next month where we'll dig deeper into the mobile health application world and discuss some of the things that are out there and what they can do, and perhaps get some insight into how young people feel about those sorts of things as well.
Okay, well, thank you very much for doing that. I mean, that was really good, and we had more questions that we could handle. There were a huge number of questions, so that's great. So thanks for doing it, and I think we'll end this now and let Andy go back to bed and so it's probably so late he won't bother.
5 a.m. now, yeah.
It's 5 a.m, yeah, absolutely. Anyhow, I mean, thank you for doing it. Thank you for all the questions, all the points, and then this is a story that will go on because we've got other webinars. We've got the meeting at the House of Commons, and I hope you'll join us that, and we'll get others to join us. And as I said, we'll disseminate the recording of this to many, many more people than turned up this evening, and so that's great. So thank you all, and thank you, Andy, and thank you for Emma. So we'll end this webinar now.